Welcome to the Orgasm Hour Live Q&A. I am Dr. Suzanne Mulvihill, and I was just shut down by YouTube for showing what a penile fracture actually looks like. My content was completely removed, so I am trying to go live here again. My apologies for that. I did appeal the decision, and it's quite unfortunate because it was we were 15 minutes into our recording and I was shut out. So for those of you who may try to come back on, you can see that I'm live again, and we are not going to show any images. I was describing what a penile fracture is, and I'm afraid to even show you at this point what a penile fracture is because I was shut down for it. So that just shows you like how much we need content around sex education, because there's no problem like having 150 downloads of porn a day, right? But as soon as I show through YouTube what a penile fracture is, I'm shut down for it. It actually pisses me off. Anyway, you're going to get the raw version of me here. Being live, I'm not going to go back over what as I mentioned, I can't really show any content related to a penile fracture because I can be shut down for it by YouTube. So let's just take a look at the research. Okay, so for those of you that were here earlier, a penile fracture, what a hemotoba is literally like you get a blood clot, and you'll end up getting, if you can Google penile fracture and see what it actually looks like on your own computer, even while you're listening to me, and you can look at images and see what a penile fracture is. And that it'll cause bruising. It often has an immediate sound of a snap, as if you're snapping an ear of corn. And in my lifetime, I had never heard of a penile fracture. I had not been in any sexual relationships where it had happened. And I had never heard of it happening to anybody that I knew. The only thing I did hear about was a trauma to a gentleman who it wasn't a penile fracture, but it was a woman had bit his penis while she was giving him oral sex. And for 7 years, he hadn't had an orgasm through oral sex because the amygdala, the part of his brain that stores trauma, won't let him have it. And that's what I was sharing about the importance of communication between partners, that if either partner has had sexual abuse in the past, any type of no, I wouldn't call that abuse, but it was sexually traumatizing, right? She unknowingly did something that actually hurt him and caused trauma. So for him to be able to communicate in the future and say, I've had trauma around oral sex, and he'll have to develop a process to rebuild his relationship to have that again. So let's take a look at this. This is where I realized I was cut off by YouTube. Okay, Sexual Medicine Reviews, the Current Management of a Penile Fracture, an Up-to-Date Systematic Review. And we're going to go through the abstract here. Let me see if I can make it just a little bigger so you can, no, that was the right size, I guess, so we can see it. So introduction to this study. Because of the low incidences of penile fracture, many aspects of the diagnostic process and of the surgical and functional outcomes are rarely reported. Partly why, I'm curious if any of you mention that this is only for educational. Yeah, I just wrote them back. Thank you for your comment. And I could do it live in Facebook. All right, well, maybe that's where we're going to go in the future. It's just that I like for other people to be watching, and we're also on 10 podcasts. So once this is recorded, thank you for your comment. Once this is recorded, it goes on through 10 different podcasts, Podbean, and there's a number of them on our website. You can go to orgasmhour.com and you'll be forwarded to the Orgasm Hour page where all of our previous episodes are. This is episode 7. Okay, so thank you. To systematically review, the aim of this study is to systematically review the current literature on the surgical management of penile fracture, focused on etiology, diagnosis, functional outcomes, and the post-operative complications. Because as I was sharing in the first one that got shut down, the images, when you pull up penile fracture, 95% of the images are surgical. They're involving blood. There are some with there's a butterfly where the penis and his entire genital area is purple from the penile fracture. So it is a very serious thing that really we all should be aware of, because it can be so harmful to a man, right? And he can harm himself through masturbation. So we're going to get into, even in the Middle East, there's certain techniques that I've even learned about. And I have to thank a woman in Australia who had recommended this video and asked me, and she has a few questions here. I have questions from a woman named Jenny who had asked me some of the most dangerous sex positions, the hand moves on an erect penis, and we'll try to get to some of these questions. So let's continue here. The methods of this study was to present the review on the existing research, and then what they do is they do what's called a systematic search for all these different terms: penile fracture, fracture of the penis, trauma of the penis, rupture of this corpora I need to learn Latin, cavernosa, and immediate management of the penile fracture. So it's a very serious thing. And what I was sharing in the video that got shut down is, if it happens to you, go to the emergency room immediately. Do not wait. A hot pack or a cold pack is not going to help a penile fracture. You will have to have, in most cases, surgery. So what did they measure? They measured the etiology of the penile fracture, the clinical presentation, the types of that's kind of, I'm not going to read all of that. Let's go into the results. Okay, the total number of patients analyzed was 438, and the patient's average age was 36. The most frequent reported cause of penile fracture was sexual intercourse, 80% of the cases. So it's happening while they're having sex. And in one of the studies, it said it's mainly heterosexual sex. It's not same sex, it's heterosexual sex. The most common finding at examination was a penile hematoba, 97.5%, which is like a blood clot, right? Where it becomes purple and it has to be surgically removed. Although operator dependent, in experienced hands, ultrasonography was found to be a useful tool in confirming the exact location of the tear and identifying the presence of any concomitant, anything that from the urethra from being able to pee, any damage to that as well. So it says here, early surgical repair of a penile fracture was found to be a safe procedure, although long-term complications are not uncommon. So be careful with your penis, gentlemen, ladies, be careful with his penis. The referral center that manages a large number of cases seemed to obtain more satisfactory long-term results with a significantly smaller number of complications. So it says here, a low incidence of post-operative complications and full satisfactory functional outcomes are reported when early repair is performed in high volume centers. So basically going somewhere, which can be quite challenging when you're in an emergency situation, to go find a high processing center for a rare condition, right? I mean, it's kind of like, think about this. If you go scuba diving, right? If you go, like I used to be a scuba diver, and I would know, if I went to Honduras, for example, you find out where the chambers are, or you get the DAN certification, that in case you're going to have something happen, you're going to be able to be flown to it. Where here we have penile fractures, and it's saying here that the best outcomes are going to happen in places with high volume centers that deal with a rare incidence. So here's kind of like, it's an interesting spot to uncover. You know, look, I was showing images of penile fractures, and I got thrown off of YouTube, literally, and got a strike, a warning for that. And I already appealed it, but I didn't even realize I got thrown off. Anyway, so this particular study, you can see it's 80% of the cases, or 80% were penile fracture during intercourse. So we're going to find out. This is some interesting. Let's go to the introduction real quick here. A penile fracture is defined as a rupture of the tunica virginea of the, I mean, it's too much scientific language for me, part of, you have to go look it online, and it can occur in isolation or in association with, we talked about, the urethra tear, meaning it can also tear how he's going to pee, urinate. Although penile fracture is considered a rare event in Western countries, this condition is much more common in the Middle East, possibly because of a different etiology of the fracture in those two geographic regions. Well, I'm going to tell you that there's a type of maneuver that's done mainly in the Middle East that actually can cause this type of fracture. So it says here, in Western countries, penile fracture usually occurs when the erect penis hits the female pelvis during intercourse. So the image that I had shared previously showed, and you'll have to Google this yourself because I get thrown offline if I show it to you. I probably can't even say the word XEXUAL content, right? But it shows that in doggy style, it can hit the pelvic bone. The penis can actually look like this banana. It can bend like that, and it'll pop. It'll literally sound like a ear of corn popping. That will send you, gentlemen, your penis will immediately become flaccid. You need to go to the emergency room ASAP, ASAP, ASAP. As rare as it may be, it's an ASAP emergency. So in Western countries, we talked about it. Okay, it's when the erect penis hits the female pelvis during sex. Now we may think of a hard penis as something that's like, even, it's so firm and it's so hard that how could anything ruin this? How could anything actually hurt this? Well, if it's bent, if it's actually hitting her pelvic bone and it bends, he's going to end up in the emergency room for that. And it can also be through very aggressive type of sex. It can be through aggressive massaging, that the massaging is so firm that it bends the penis. These are different ways that it can happen. So in the Middle East, and we're going to look at this next, the Tag Han-Dan maneuver. And anyone who's listening or watches, if you're aware of this, you're welcome to share. This particular maneuver seems to be responsible for the vast majority of cases. So let's talk about that, right? What is this maneuver? Here we are. So this is a journal article titled "Fracture of the Penis by the Tag Han-Dan's Maneuver." It's about a case and literature review. So a case means we're going to be reviewing one particular case of a gentleman who this happened to. And this particular, I always like to see when the study is published. I don't see the study on this day, but it is titled "Fracture of the Penis by this Tag Han-Dan Maneuver," about a case and literature review. Actually, no, this paper was written in 2024 from the Department of Urology at the Hassan University Hospital in Morocco. Okay. And so it went through peer review. It was reviewed and peer reviewed. And here's the abstract. The Tag Han-Dan maneuver is a rare form of penile fracture. But again, we just read from the other research that most of these penile fractures happen in the Middle East, where this particular maneuver is practiced. And how does it happen? It is more observed in the Middle East and Northern Africa, which is where this study is from. We report a rare case of penile fracture occurring in the North African, this gentleman, subject, living in France after the forced maneuver of lowering the penis to simulate erection, also called Tag Han-Dan maneuver. Okay, so let's repeat that. So it's after a forced maneuver of my understanding, it was lowering the penis when it was erect. It's getting rid of the erection, like trying to get rid of the erection, and it forces it and it makes it, he can get a penile fracture as a result of it. Okay, so let's read a little bit about this. Penile fracture is a rare emergency. Okay, yes. It refers to the rupture. We talked about that. It can be associated, again, you're going to start hearing some similarities with the injury to the urethra, which can cause problems with urinating. It's a pathology of young adults primarily, with a large predominance among young single people. Interesting. It is observed exclusively on an erect penis. So again, the gentleman takes the penis, his erect penis, and he makes it go away so abruptly that he causes a penile fracture. Okay, the most common cause being sexual intercourse. Now, it can hit her bone, and it can bend and pop. So her pelvic bone, and that can happen in the image that I shared that I got cut off of YouTube on an image. I'm afraid to show you those for fear of getting a strike again. But if you could just imagine the penis is entering the vagina and it hits her pelvic bone, if he's thrusting hard, it can actually bend his penis, and he can end up in the emergency room as a result of it. So it's that even though its incidences are low, this Tag Handan maneuver, it's the most common cause in the Middle East. And in this particular person, let's see, the objective of this observation is to present this form of penile fracture exceptional in Western countries, which is called the Tag Handan maneuver, consisting of an intentional and forced flexion of an erect penis to simulate or allow its detumescence, like to get rid of his erection. So again, a lot of times we talk about sexual suppression, and it's particularly in females. Oftentimes, this is the first show I'm doing, even though I have half of my viewers are male. Thank you, gentlemen, for watching. I'm happy and I'm delighted to begin to share also how we can serve you during the orgasm hour, because you're just as important. You're as important as the women. So this penile fracture can happen to you, and we want to inform women, and for even if there are any of our same-sex couples that are watching, that this can happen in same-sex relationships as well. And it can happen to men who may not know that it can happen to them, even during masturbation. And we're going to look at the statistics of how often it can happen. So this was a 32-year-old African man. He's married, and he was living in France for approximately 5 years, who presented to the emergency room for a fracture of the penis occurring following a forceful lowering maneuver on the penis in erection. He did it to himself. Sad, really, unfortunately, sad. And he wanted to hide his penis, which was erect. The patient reported feeling a crackling, which I had shared with you. You're going to hear a crackling sound, like a cracking of an ear of corn, followed by pain and immediate detumescence of the penis. He lost his erection. He had, and I'm not going to show you the figure because YouTube is watching and threw me off the first episode. He had no urination problems, luckily, but he noticed a deviation and bruising of the penis. The increase in the volume of the penis and the bruise, which was becoming more and more significant, pushed him to consult the urological emergency room. This is a patient who was very anxious. Examination of his external genitalia showed deviation of his penis. So it ends up, you end up going in looking with a penis like this, right? Where the penis, that there's a hematoma, there's blood gathering. And if you Google, even while you're watching or later, just Google penis hematoma following a penile fracture, and you will see it for yourself that 95% of the images relate to surgery, removing the blood clot. Okay, so there are images in here, and I'm not going to scroll further because I got thrown off last time. So let's take a look at the most dangerous positions. And this was one of the questions that I was asked by Jenny, what are some of the most dangerous sexual positions that cause a penile fracture? And thank you for the thumbs up. This is, again, a systematic review. So systematic reviews mean that they're going to look at a lot of literature. They're going to go out and look in peer-reviewed literature and see who did research on this and what does all of the research have to say about what is the most dangerous sexual position that causes this penile fracture. This is a study that was conducted in February of 2024 in the Faculty of Medicine in Indonesia. And both of these researchers were all out of Indonesia. So the purpose of this study, penile fracture affects, and this is the statistics, okay, 1 to 10 men every 100,000. Now, that means it's rare. It's 1 to 10 men out of every 100,000 men in East Asia. And the primary reason is sexual intercourse. But the knowledge regarding the most dangerous sexual position is not well explained. Well, isn't that interesting? That the main reason that it's happening in sex, and most women don't even know about it, and men don't know about it either. Like, why is this? We don't know about something that can cause so much harm to our bodies. Why don't we know this? It's a different topic, but we don't know it because sex is suppressed in our culture. Okay, so how did they do it? They searched for sexual positions related to penile fracture in all these different research in Google Scholar, PubMed, and different databases, basically. And the criteria, they come up with a list of the criteria that was relevant. And looking for the number of sex positions, it was analyzed by odds ratio and different types of statistical analysis. The results, which is always like the highlight, right? So check out the results for those of you that can see or are reading along with me. 12 relevant papers involving 490 patients involving, 169. Now, MTP, that stands for man on top position. So there were 12 research papers that involved 490, let's just say men, 490 men. The majority of the cases were the man on top. Isn't that interesting? Okay, the majority of the cases were man on top. 120 cases, WTP, which stands for women on top position, and then 158 were DSP, doggy style. So the number, they didn't put them in order, but if we were to look at it again in order, during sex, to answer Jenny's question, the 3 most common ways based on 490 patients and 12 different studies, 490 men and 12 studies showed that the number 1 way that a penile fracture occurs is when the man is on top, thrusting, fast thrusting, and he's not aware. She may move her pelvis in a certain way. He may move his pelvis in a certain way. And if he hits her pelvis bone in a certain way with a lot of force, he may end up with this. And it doesn't look like this, let me tell you. It's going to be a, even though the banana's good, it's going to be, when he gets to surgery, a bloody mess. Okay, so 169, man on top. Number 2 is doggy style. And number 3 was woman on top. And there were 43 no intercourse cases, which could be through masturbation alone, where he's giving himself he's massaging, he's stroking so roughly that he gives himself this, or that procedure, the Tag Handan maneuver, where they force in the Middle East the penis down to get rid of the erection, being the number 1 reason that penile fractures occur in the Middle East. Okay, so it says here the meta-analysis of all the sexual positions was male on top was statistically a p-value of 0.04, meaning it was statistically significant, less than 0.05. And it's a little confusing here. And the doggy style was also another reason that it was penile fracture occurred through that. So what's the conclusion? Here we go. The man dominant position, man on top, and doggy style positions were significantly potential for penile fracture. Gentlemen, that's important for you to know. That, it might be fun, and you have to also be careful, which speculated that the man, that when a man is dominated and dominant, and very excited, intercourse may become highly vigorous and impact trauma. This study found that man's dominant position consists of the doggy style and the man on top, and it significantly led to penile fracture. So it sounds to me as if men are not aware that this can happen. And it's because the woman in this position, she's the passive one, right? But she could move in a way that can also cause this. So just be aware. I remember reading about a woman who said that the guy put the lube on. Now, putting lube on, she's not really ready, right? He puts the lube on. This is what she said, and I've shared this in a couple of my episodes. He puts the lube on, starts jackhammering away. That jackhammering can cause a penile fracture. So just know that. Okay, let's do another study on sex positions. This is a research article in the International Journal of Impotence Research from 2017. The relationship between sex position and severity. So the last one we just watched was about which positions cause a man on top position was number 1, doggy style was number 2, woman on top was number 3. This one talks about which position causes the most severe type of penile fracture. Okay, let's take a look at the objective of the study. The objective of the study was to evaluate the relationship between the sex position and severity of penile fracture. We studied 90 patients with penile fracture. The mechanism of injury and the sex position were assessed. We divided our sample by the etiology of the fracture into 6 groups: masturbation or penile manipulation, which is that I can't pronounce it, Tang Han Dan maneuver, where they force the penis down, the gentleman in the Middle East, to get rid of their erection. So that's the one, okay? So we look here. Lost my spot here. 90 patients. The mechanism of injury in the sex position was, we divided our sample by the etiology of the fracture into 6 groups. A, masturbation or penile manipulation. B, man on top, which we know was number 1. C, doggy style, which in the 12 other study, in the other systematic review was number 2. 3, woman on top. 4, blunt trauma. 5, rolling over fracture. We used they used a statistical test to conclude the populations under the study. The patient ages ranged from 18 to 66 with the mean age of 39. Investigation of the injury mechanism identified sexual trauma as the main etiological factor involving 69 cases. So it was a result of sex. So the majority of the cases here came through sex. Okay, the sexual position at the time of the injury varied, with 23 cases, or 23.5%, occurring in the man on top, 37 cases, or 41%. So in this study, the doggy style was so far the majority, or the most, 41% in the doggy style, and 9 cases, or 10%, in the woman on top. We do not observe differences between the severity. They did not observe differences between the severity of the penile fracture between the doggy style and man on top, but the doggy style had more severity of penile fracture when compared to the woman on top. Wow. And penile manipulation. The man on top and doggy style positions showed more associations with bilateral fractures, which is bilateral, both the urethra, meaning his ability to urinate, and the penis itself. So it's a pretty serious thing. And to know that the doggy style position is the most, what did it say here? The doggy style had more severity of penile fracture when compared to the woman on top, the man on top and the doggy style. So we saw in the other study that looked at 12 research papers that doggy style was number 1, or actually man on top was number 1, doggy style was number 2. And here, doggy style and man on top had the most severe types of penile fracture. So just take that in for a minute. And for those that are joining, thank you for joining. I did share, thank you for the thumbs up. I did share that I got thrown off after 15 minutes in my previous live, which had the title and everything prepared for almost a month, because I had showed some images of what the penile fracture actually looked like. And one of them was through, the woman was on top, and it was actually a porn image. Maybe that's why they didn't like it. I don't know. I'm afraid to show any images at this point because I got a strike. But it showed the woman on top backwards on the man's penis, and his penis, I can just tell you right now, it was bent like this. And there were 700 some thousand people had viewed it, and it said woman on top nearly broke the guy's cock. And if the guy didn't end up with a penile fracture after she was on top, and she actually in this, she was, you know, she was facing the other direction. So she had control over the penis, and her on top and leaning forward and bending the penis to a position like this, dangerous. Can end up in the emergency room with a serious surgery and a serious condition that can have long-term effects. So it's important for men and women to be aware, both partners and men, same-sex relationships. It happens less in same-sex, but it does happen, and that this is a pretty serious issue. So, all right, let's go. We've already understand about it's a rare emergency, and you have to go to the emergency room. So let's look at some other dangerous positions during sex. This is a study and what the treatment options are. So even though I have this one titled Other Dangerous Positions because they're inside of this paper, I've reviewed all this obviously to prepare for this. And this is a study called Treatment Review, Current Treatment Options for Penile Fracture. It was 2004. Division of Urology, Department of Surgery in Los Angeles, California. And the diagnosis of penile fracture describes the traumatic rupture. We already read all this, right? The penile fractures typically occur when the engorged penis arc is forced to buckle and literally pops under pressure of a blunt sexual trauma. Patients typically describe immediate detumescence. They will immediately lose their erection, severe pain and swelling as a result of the injury. Prompt surgical exploration and repair is the most efficacious therapy, meaning you have to have a surgery. And like I said, if you Google penile fracture, you will see 99% of the images are bloody because they're involving surgery and removing the hematoba, removing often the blood clot that can happen. And again, I'm not a surgeon to explain, but I'm just giving you like what, you know, where I would think the blood clot, there's a blood clot that has to be removed. The hematoba has to be removed surgically. I'm not saying in every case, I'm just saying in general, as someone, as a sexologist, sharing with you what the research. So prompt surgical exploration and the corporal repair is the most efficacious therapy. Although a majority of cases can be diagnosed from the history and physical examination alone, radiographic studies, including retrograde type of, they can aid in the diagnosis and unusual cases. So they have to really identify where this hematoba is, where to perform the surgery, where the fracture is. It is serious. It's not a little thing. And to think that I've, you know, had sex throughout my life with men and not ever even heard about this, you know, so I really have to thank Jenny in Australia for sharing this with me and for suggesting this video for all to become more aware and care for our partners, right? So let's take a look further in this study. We're not going to read the beginning because we already know what a penile fracture is. But we know the buckling that can occur, and we talked about the snapping of it, the sounding like here it says here. It says some patients have likened the sound of the injury to the snapping of a corn stalk or a glass rod. I mean, that's pretty serious, right? Let's see what else is in here. Penile fractures. Okay. I just want to see if there's anything in here that we want to take a look at more. Immediate surgery, here, it says here, you know, instead of conservative therapy, current recommendations are for immediate surgical exploration and repair. So it's not something you're going to fix with an ice pack. you got to go to the emergency room. Okay, and then where's the location of it? It says here, regardless of the incision site, because again, they've got to cut open the penis. Proper dissection must be carried down until the hematoba within is exposed and evacuated. They have to take it out. I was thinking they were going to have some mimicking injuries. Okay. Despite the stereotypical history and reliable examination of most penile fractures, negative findings are occasionally encountered at the time of the penile fracture exploration. Presumed penile fractures unaccompanied by rapid detumescence, or the lack of the sound, are more likely to have negative consequences, negative explorations, meaning if they don't, this is really doctor talk. If they don't hear, did you have that cracking sound? So I don't really want to get into the doctor language. I want to keep it so that we can understand it and how we can recognize it, go to, a man can go to the emergency room for it, and a woman can help, or their partner, if it's a man-to-man relationship, can avoid these types of situations. Okay. We know about the current treatment. Let's see if there's any. No, they didn't really get into how do we not have it. Okay, here. Next one. This is the alteration. This is a review article, and it's called The Alteration in the Etiology of Penile Fracture in the Middle East and Central Asia Regions in the Last Decade. This is a literature review. So this is similar to a systematic review, but not exactly. They're going to review the literature. And again, we talked early in the show about this Tag Hamdan maneuver and how the forcing down of an erect penis, the one study, getting the erect penis to go down quickly, how that can actually, more cases are in the Middle East, in the Asian, and this particular paper is actually out of Qatar. From the Department of Urology. So obviously it happens more prominently in the Middle East. So let's take a look at their abstract, and I'm going to make it a little bigger so we can hopefully those of you that can see it can read it. Penile fracture is a well-recognized, relatively uncommon medical condition, and its etiology differs according to the geographic area. We had talked about that. In this review article, we evaluated literature reported in the past 10 years, aimed to verify whether there has been any change in the etiology of this condition. A literature review was done for studies published in the last 10 years and focused on the etiology of penile fracture. Let me stop there. How is it going to be any different if we don't teach anything about it? Like, how many women and gentlemen and men and women have heard about this? I'm not sure so many, but the repercussions are so severe that it seems that it should be just as important as knowing you can get a woman pregnant through ejaculating, through sex, that a penile fracture is just as important. Knowing that can happen and taking precautions. The woman on top, the one image, like I said, that I got thrown off YouTube, probably for that, I don't know, after the first 15 minutes, she was on top, facing the other direction. And the penis, his penis, you figure this is his body. The penis was literally bent inside her body like that. If that didn't send him to the emergency room, I mean, the title of this said, nearly broke his cock, right? So it's just as important to be aware that this can happen for men and women, and also through stroking. Even massage is one of the ways that is fast massaging through masturbation as well can cause this type of fracture if the penis is bent quickly or it bent at an angle. A literature review was done. Okay, the past 10 years. Okay, inclusion criteria. They looked for English language articles. They wanted more than 10 patients in any of the studies, and they wanted studies that originated in the Middle East and Central Asia. The data related to the study population, etiology of penis fracture, the clinical presentation, like what did they come to the emergency room for, the investigations, the management, the outcome, all of that was analyzed. 1,629 men from 21 original articles were included in the study. The mean age was 33, plus or minus 3 years, And the etiologies of the penile fracture were vigorous sexual intercourse, right? Manual bending of the erect penis, and that can be done through stroking the penis. The woman might be stroking the penis, the man might be stroking, and that procedure that of getting rid of the erect penis, the tag Hondon maneuver of forcing the penis down, can cause this fracture too. So, okay, etiologies of the fracture were vigorous sexual intercourse, manual bending of the erect penis, vigorous masturbation, rolling over in bed, and blunt trauma in 41%, 29%, 10%, 14%, and 6% of patients. So that looks like that was the statistics, meaning sometimes you have to kind of read through this. So 41% was the sexual intercourse. The manual bending was 29%. The vigorous masturbation was 10%. The rolling over in bed was, that was kind of surprising, right? 14%, and blunt trauma, 6% of patients, respectively. Treatment choices were surgery and conservative in 1,580, 95% of the cases were surgery. 83 or 5% of patients, respectively. So in 5%, there was, it sounds like there was some other conservative type of procedure done. I don't know what that means yet. A higher incidence of complications was found in the conservatively treated patients. Well, there you go, right? So the people conservatively, meaning it wasn't surgery. 95% of people had surgery, 5% had some other type of procedure done, and there was more complications found in this conservative treatment patients who were treated conservatively. At a conclusion, in the last 10 years, vigorous sexual intercourse was the commonest etiology of penile fracture in the Middle East and Central Asia regions. Surgery remains the preferred treatment option for patients diagnosed with penile fracture. So it's pretty heavy duty. This is another study. Now, I'm not sure if I shared this with you before we get into this, or if I shared it in the first 15 minutes that got cut off because I showed through YouTube Live what a penile fracture actually looked like, and I got kicked off, which I had to start over. So no images on this one. You'll have to look it up yourself, unfortunately. Anyway, I've already talked about that. But I'm not sure if I shared with you about the gentleman who, and you can tell me if I did, but that he had, he was being given oral sex, and the woman bit his penis. I'm pretty sure I shared it here. She bit his penis as he was ejaculating, and he said he has not had an orgasm through oral sex since. That's because that's a trauma. That there couldn't be a clearer example of trauma than something like that, where it gets stored in the part of the brain, the amygdala, that stores trauma. His brain is going to protect him that never happens again. And the way it's not going to happen is he's not going to ejaculate while he's receiving oral sex, because that's how it happened. Now he's going to have to unpack that himself, and that would require therapy. That could require, it could just require a woman who supports him, or what are they called? There's a certain type of surrogate sex partner that could retrain his body, or just a loving patient, a loving partner that he could be open with and honest with and say, listen, this happened to me. I haven't had an orgasm. I haven't ejaculated through oral sex since this happened to me, because it was very traumatizing, and de-traumatize his system so that he feels not that he feels safe, his brain has to feel safe. Our brains are, they call it the lizard brain. It is what keeps us alive. So not that he's going to die from having his penis bit. However, it caused a trauma, and his body just won't let him ejaculate that way. So let's get into, this is a study then about a bite that happened, and a urethral laceration. So the urethra, right, where the urine comes from a human bite. And this was a study that was conducted this was study out of 2017 in emergency medicine. We're not going to read through the whole thing, but it's a case report of the University of Illinois in Chicago. and just how serious and how important it is for women to be aware that biting, we don't bite. It's similar to men putting their hands on the women's neck. I read a story a woman talking recently about, she said she didn't like the hands being put on the neck, and the guy kept doing it anyway. And she had a couple hundred women that said, get a new boyfriend. So we also need to, ladies, respect, we don't, bite the penis, right? So here again, introduction, the most reported male genital injuries relate to sexual activity. Okay, so yeah, most reported male genital injuries related to sexual activity have been penile fractures with ruptures of the corpora cavernosa, often due to vigorous or alternate positions during intercourse. Associated damage to the urethra with penile fractures occurs in 10 to 38% of cases, and isolated male the urethra injury due to sexual activity is exceptionally rare, meaning when you have both the injury and the fracture and the urethra problem at the same time, it's more rare. Okay, so most of the published literature on bite injuries of the male genitalia has involved animal bites. That's interesting. Human bite injuries to the penis is a topic rarely discussed in medical literature. Well, this gentleman shared it with me. I'm a clinical sexologist. It often comes up in conversation. Even when I meet people at parties, a woman had shared what kind of vibrator she bought last week, when I was at a dinner party. And it's just open conversation, right? But it's rare in the literature. These injuries are probably underreported because of embarrassment. So the man doesn't want to share that, listen, I got bit, right? A woman did this. It's important to report it. And there's frequently a delay in seeking treatment. To date, only infectious complications and amputation from human bites to the penis have been reported. Jesus, that's pretty serious. Okay, so the case report. A 30-year-old male with no significant past medical history presented to the emergency room, complaining of a bite wound to his penis that had occurred approximately 1 hour prior to arrival. The bite occurred while receiving oral sex from his girlfriend, and he was unsure if it was intentional or accidental. So he didn't know, did she do this on purpose or did she just not know what she was doing? And he was unsure, okay, it was intentional or accidental. He stated that there was some bleeding from the wound that stopped with direct pressure. He had not urinated since the injury. Physical examination revealed a 0.5 centimeter superficial skin, opening basically on the mid-penile shaft in the midline. Several other superficial markings, were noted on the penile shaft. A small amount of blood was noted at the urethral meatus. The patient was able to urinate, and urinalysis revealed the blood cells, let's see. The urinalysis revealed greater than 100 red blood cells per high power field. This is like medical language, and 5 to 10 white blood cells. Because of concern for an anterior urethral injury, a retrograde something was performed. The lumen, this is getting into scientific, really. The lumen of the mid portion of the penile urethra was noted to be irregular with a small amount of contrast, extravasation of parcel. He was lacerated in his urethra through this particular bite. And the patient was discharged with a leg bag and a prescription for 7 days of prophylactic antibiotics. Due to a lack of medical insurance, the patient was unable to follow up with a urologist. He had returned to the ED 6 days later. His catheter was removed, and he was able to void without difficulty. So even though it says here bite injuries to the penis are rarely reported, a study of human bites to the New York City Department of Health found that 892 human bites, only 2 were to the penis, probably because they're not reported. But again, in just a conversation with a man, the woman had bit his penis while he was ejaculating. So, what I want to say, and there's another movement. So we're going to kind of step off of this and go into some of the moves that can actually cause some problems with erections. Let me stop sharing here and see if I can get to a procedure called, let's just call it whipping. When you go around like this with the penis, this can cause penile fractures. The bending of the penis we talked about, being on top of the penis in I don't know if we would call that reverse cowgirl, I think it is, when she's facing the other direction and the penis is literally bent like this inside of her. These are all potential cases for penile fracture. And like I said, being that a gentleman had shared with me that a woman had done this, and then I was asked, it was suggested that I had done this video and really start informing women that to be careful, of the man's penis when it's erect, that it is not just a sturdy something that is, I have a candle here, it's not, it can be damaged and seriously damaged. So I invite you to look up penile fracture images, since I can't share them, or I'll be thrown off of. I'd like this to actually finish when we finish, so I don't get, because when I got thrown off, literally it erased the 15 minutes that I even recorded. Really have conversations as a couple of vigorous sex, maybe even have a conversation about penile fracture. If we notice that the literature says that it hasn't changed, the percentage hasn't changed, how's it going to change if we don't change anything? It's not. If we don't communicate about it, I mean, myself, having not known about this in my entire sex life, never heard about it until it was brought to my attention, and I learned about it in school. So it's great for conversation, really, and it's also good, being that I work a lot with women that talk about orgasm. How do you like to orgasm? I had a gentleman last week say, what kind of safety do you need? He was in a conversation like that of asking, create a container before sex, particularly with new sex partners, to talk about these types of things. Ask questions. Know that doggy style is a very doggy style, man on top, vigorous movement can cause a penile fracture if he hits her pelvic bone. If this hits the pelvic, let me straighten this out again. But if this penis hits the pelvic bone, the penis can actually bend and it can have a fracture and he can end up in the emergency room. So I didn't answer, I hope I answered most of the questions that were asked of me today. I did my best. Most dangerous is the downward, a sharp angle, holding, forcing another angle, like forcing any kind of angles. It's not meant to be bent. That's why it's straight. It's not meant to be bent. It's straight. And don't, gentlemen, push your penis down to get rid of your erection, or you might get rid of it for quite some time with a penile fracture. So love on your bodies, ladies and gentlemen. Love on your bodies, all of your body. Honor the fact that you have an erection, gentlemen. Those of you who are in the Middle East, it's not something to be ashamed of, that you have to hide. Women who can orgasm, women who have orgasm problems, sex is meant to be enjoyable. And it's really, a lot of what happened is religion over the last 2,000 years that has forced us to repress sexuality and end up with situations like this with penile fractures where men end up in the hospital. And if you do happen to hear a cracking sound, or if you do lose your erection and you're in severe pain, please go to the emergency room. So I'd like to thank you for watching today. I'm Dr. Suzanne Mulvihill, here with you with the Orgasm Hour on penile fractures, good communication, avoiding any positions that being aware that the pelvis can move and the woman can actually participate in causing this type of fracture. The man can have it happen by himself through stroking his penis himself. It can happen through massage. It can happen through forcing different angles. Man on top is the number one. Doggy style is right up there with it. And woman on top is also one of the ways that penile fractures occur. Be safe in all ways. Lots of love to you all. Till next time, Dr. Suzanne signing off from the Orgasm Hour. Thanks for watching.